Joining us is Dr. Pratik Talati, neurosurgeon and director of Focus Ultrasound with Penn Health. Many people think brain surgery automatically means opening up the skull, but there's something that doesn't have to do that called Focus Ultrasound. Tell us about this. This is very exciting.
Thank you so much for giving me the opportunity to talk about this exciting new technology. So focused ultrasound has been around for about a decade, and it really is FDA approved to help treat essential tremor and Parkinson's disease. It combines two different technologies. So MRI, which acts as the eyes of the procedure and allows us to see where we are in the brain, and ultrasound technology, which allows us to do the actual treatment by targeting a specific area that causes tremors.
So who is the ideal patient for this?
So ideally, patients would have tried medications that help with tremors, and so if the medications don't provide enough efficacy or they have side effects from the medications, then they would be candidates for this potential treatment.
So walk us through. When the patient comes in, what are the first steps? And is it outpatient?
Yeah. It's a completely outpatient procedure, and this is why a lot of patients love it. We have an amazing team at Penn State Health Hershey Medical Center. So when patients first come in, they'll meet with our nursing staff who will put in an IV and measure their blood pressure and heart rate. We then have to do a complete head shave so that allows the ultrasound waves to get to the right spot in the brain. We then put on a stereotactic frame, which allows us to do the treatment so that patients do not move their head. We then go into the MRI scanner, which allows us to see where we are in the brain, and we do test doses to make sure that we can find that spot that's causing the tremor while minimizing side effects. And then we do a treatment. After treatment, we then remove the frame and patients go home about half an hour to an hour afterwards.
Yeah, that is amazing. What about improvements? Can patients see improvements almost immediately?
I would say the majority of our patients, and almost all of them, tend to see an improvement in their tremor by the end of the treatment. And sometimes people end up with additional delayed improvements in their tremor, but I would say for the majority of patients, they see an improvement as soon as the treatment is done.
And what is the reaction that you receive from them?
All these patients are just ecstatic and elated that their tremor is gone in that hand.
Yeah, and this really is a life-changing experience for them, because when you have tremors, it really does affect almost everything you do.
Yeah, I've had patients after this treatment say that they're just so ecstatic that they're able to eat and drink, even drive a car, now that their tremors are better.
Wow, yeah, that is wonderful news. Thank you so much for sharing this with us.
Thank you so much for having us.
And if you would like more information, or if you would like to make an appointment with the Penn State Health Neurosurgery team, scan the QR code on your screen, or you can call this number 855-432-0190.